All right.
Welcome everybody to the March 26, 2026 Rockingham County Board of Commissioners meeting. I call the meeting to order. Please ask everyone to rise for the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We've got a full house in the fishbowl today. It's very exciting, including all three commissioners. So we'll move right into the RFP openings and awards. And Commissioner Tombarello, could you make the first motion relative to sprinkler head replacement?
Make a motion to authorize the senior director of facility planning and IT to review, evaluate the proposals and return with a recommendation.
Second.
Any discussion? Hearing none. Commissioner Tombarello?
Yes.
Commissioner Godu?
Yes.
And I vote yes. Next, we have the opening for the condensate piping installation.
Motion to authorize the senior director of facilities planning and IT to evaluate proposals and return with a recommendation.
Second.
Any discussion? Hearing none. Commissioner Godu?
Yes.
Commissioner Tombarello?
Yes.
And I vote yes. Next, we have the award for the fire sprinkler testing.
I'll make a motion to award the proposal for the fire sprinkler testing to Encore Fire Protection for the period of April 1st, 2026 from March 31st, 2027 for an amount not to exceed $14,834 as recommended by the Senior Director of Facilities Planning and IT.
Second.
Any discussion?
I just have a question. There was another vendor that bid like a while ago.
They didn't bid.
It was really cheap.
They were really cheap, but they also charged us an additional $14,000 in repairs, and we have $31,000 that's in quotes on hand right now. But more to the point, they didn't show up for the site visit, so they didn't submit. They didn't even call and ask to be excused from the site visit because they were familiar. They just totally missed it.
Okay.
Well, it seems like that might be reflective of some
Maybe it's
concern.
not a good fit.
Not a big good fit, but fortunately, we got two, in this instance, we had two bidders who did the site visit too, and this was the least expensive, so. That's good. On the motion, Commissioner Tumber, do you have anything else?
No.
Oh, okay, Commissioner Godu?
Yes.
And I vote yes. Next, we have the award for ammunition in the sheriff's department.
Make a motion to award the proposal for ammunition to AAA Police Supply for the amount not to exceed $16,028 as recommended by the High Sheriff.
Second.
Any discussion? It was the least expensive of the bids, and once you factored in some of the other costs of shipping, because this was free shipping. On the motion, Commissioner Godu?
Yes.
Commissioner Tombrello?
Yes.
And I vote yes. Next, we have some meeting minutes to approve on the consent agenda.
Make a motion to approve the March 12th, 2026 and March 19th, 2026 public and non-public minutes.
Second.
Discussion?
Good job.
Thank you. And thank you, Lisa. But I worked hard. It's not easy. On the motion, Commissioner Tombrello?
Yes.
Commissioner Godu?
Yes.
And I vote yes. Next, we have adult medical daycare payout reports for January and February for discussion. Commissioner Tombrello?
I just want to bring up that you guys have followed, I support adult medical daycare, but I think we need to take a long look at, we're spending $44,000 out of the $100,000 on transportation. And I think we're drifting where we're not supposed to be. I looked at it and I added up for January. I think the number was either 11 or 13. I tried to print it.
I
I
know.
just did cyber security and now my printer's not working, but I didn't call Robin. Oh, here it is. Thank you. So I just think, I support it. And, if you look at the bottom, adult medical daycare budget of 100,000, of the 100,000, 44,000 is to be used for transportation. And I looked at how many people we're taking care of. 13 people, and it cost us in January $11,000 for transportation.
That's not reflective of everything that's going on. There's 13 people that we're paying for their supplement of 25, but I don't think that's 13
I'm
people
sorry,
that
those
are
are my
being
reports.
transportation.
I can't, can I have this back? I just can't answer without having it in front of me.
So-
I apologize.
Yeah, there are two separate issues. One, the transportation, which services all, but I think your point, which was the 13 are the number of individuals we're paying for
Kathy,
adult medical daycare.
No, that's okay. So the top two lines in the, here, I can give you 1 month and I
Here, I'm just gonna pull it up here so
The
that,
top 2 months, so there's the Easter Seal and then the Silverthorn, those are the participants that we're paying either like the copay or the piece for them to attend the program, for the program. And then the transportation line is the one for Silverthorn that we discussed for transport on the van, and then that amount fluctuates.
and did you work out the billing with, Silverthorne?
We have to reconnect today.
Okay.
I think,
I just think, you know, and you guys know I support it. I didn't vote way back to eliminate this, but I don't want to use all of our money on transportation. I want old people going to adult medical daycare. And I think if we go forward and we keep giving them money for transportation, it's almost like drug court, you know, way back when two nice judges asked us for money, we adopted drug court. I think we need to look at the transportation line and see if we're gonna spend money to get them here or we're gonna, not here. I just think the transportation line is growing too much. We need to look at it in the new budget. I do support it. I want everybody to know.
I think,
Yeah.
I'm done. I didn't mean to interrupt you,
I'm not
but
gonna have, my blood pressure might look high, but I'm not mad. I think it's getting to be too much for transportation. That's just my take.
and this is, as I saw it, this was just like a sort of stopgap to keep services going through this year where the pilot program was winding down. But I was always under the impression when we worked with them that this wasn't a permanent solution. This was a solution to make sure that when the pilot program ended, that there wasn't an abrupt halt to services for a number of individuals that was utilizing it. But this gave a great opportunity of 6 months for Silverthorne to figure it out. And so I think to your point, like, the objective isn't to necessarily, I mean, it's like almost half the budget for adult medical daycare. And as we're moving into budget season, and it is gonna be a challenging time, you know, we're gonna have to be taking hard looks at everything. And hopefully Silverthorne's been doing the same thing, which is like putting together, we gave them a 6-month plan, you know, time period to sort of navigate. And I guess maybe, you know, we can have more follow-up that if the plan is for the county to fully fund it, which is at this price, you know, and you add, it's gonna be $100,000 plus, we have to relook at it. Commissioner,
So, first of all, they haven't, I don't think they've been instructed, and I don't think they are looking at ways to figure it out. The way they figured it out is that they've asked us for $120,000 or $130,000 for next year. So.
in addition to the 100.
Total, because, which includes
6 months, right?
the, a full year of transportation plus an allocation for supplementing the residents that are going. So they put that in. I solicited, what is it that you need this year? And I gave it to Chantal to include in the budget, but this is a budget item that we're gonna have to scrutinize. And I believe that Jessica will come in and answer questions, and we can have a discussion with her around that time. And we can decide how much money we really are willing to support, you know, to support them with.
And I guess some of the concern in part of this is that they're looking at it, and I think we just don't have an entire meeting of the minds. Like, we look at this money as allocation based on use, and they're looking at it as this is
A grant.
$130,000
Right.
grant. So I don't think we have alignment. I think we need to start this discussion with, like, because I can tell, I mean, I don't know, you know, where you are, Commissioner Terrell, where
I'm
you,
right here.
Commissioner Goodgees. But I'm not sure that, you know, as we're looking at this budget season, I mean, I think that they need to be looking at realistically, knowing what we're going into, looking at other options for funding transportation, grant options. I mean, there are real grant opportunities that we see all the time that hopefully they're exploring as
I
well.
think they gotta look, we gotta make sure we hold the feet to the fire, that they're looking for grants.
Yeah.
That they're not gonna just look at Rockingham County. I mean, we closed it because the van didn't pass inspection, and we were hit back then, maybe 10 years ago, we were hit with a thing that we had to buy a new van at $78,000, and that was probably the deciding factor to close adult medical daycare. This is adult daycare, but
Well, that's when it was here.
we had the RN here, but it wasn't the van, and that had to go in the budget for us to buy a new transportation van. And that kind of got the ball rolling to eliminate, although I didn't vote for it, but that's what started it. So I just wanted them to know that I'm gonna be watching it. And maybe this needs to go into non-county specials, and we'll ask the delegation to get involved with it. And we'll look at the whole list of them and take it out of your budget and see how much the delegation supports it. But maybe we look at
We have to.
how much do you guys want to support? If you want to support it, put it in non-county specials. And let that be that budget. Don't put it in long-term care. Because
Yeah.
it's never been in long-term care. When we adopted it, we closed it, it went into long-term care. Maybe it goes into non-county specials, and let that subcommittee look at the whole thing. And they say, here's the number you're gonna get, figure out what to do.
I think that's actually a really good thought, which is like, it is more aligned with the non-county special as opposed
I
to,
think it is.
yeah.
It only got put in there because we got that grant, I think. It got into your budget because we had a grant from the state.
Through the pilot program.
The
Yeah,
pilot
the
program.
pilot.
We
So
transition.
that was a separate budget. It wasn't built into our budget,
Right.
our long-term care.
So is this long-term care expenses coming out of your budget?
So the adult medical daycare, right now, this chart that you're looking at is a budget line in my current budget. All the expenses for the pilot was a separate
Through a grant.
through a grant.
Okay.
And then we moved that one line to the transportation to this one. So it's currently from January forward, in my budget line.
Well, we'll have to discuss that. Do we want to invite them in sooner than later, or what? Because they'll come in whenever we ask.
I mean,
I thought they were scheduled for this
Yeah.
week.
I didn't schedule them, did you? I did not.
I think the email came from you, I think. Didn't it?
I think we did this.
Yeah, you know.
I do know that.
I requested a conversation today about something related, but not to necessarily this, for clarification that I had requested for today that we're talking about.
Okay.
So I don't know if that's part of
So
the
we'll,
confusion.
let's move forward. We'll bring, I mean, I think it is, we'll either slate them for next week, or if they can't come in for next week, we can maybe tie it to, our budget discussions, things like that, because that's where it's really, and regardless, it's still, we're early enough in the process that it will allow time, a few months for them to, sort of just get the trajectory of where this is going.
So do we invite them next week?
I
Or
think
what would you like?
Let's plan for next week if they're not already invited.
Next week? All right, I will contact them for next week.
You did email them next, I mean, it's fine, we'll just plan for next week.
Oh,
I
April
think we're all
2nd.
set.
So I already did this.
You said
See?
that.
Your past self is
Maybe
great.
I am young man.
April 2nd, huh?
That's where you just say, high five, self, got something done already.
You're right.
Good job.
Great job, high five. All right, let's move on to, unless there's anything else, the March 27th, 2026 payroll approval.
I'll make a motion to approve the payroll expense in the amount of $1,692,712.60 for the pay period ending March 21st, 2026.
Second.
Any discussion?
It's the lowest one we've had in a while.
I know, how'd payroll go this week?
A little better.
Great,
No winter storm.
no more.
That helped. Right?
Hopefully not.
Oh, April Fool's Day is coming too quickly, so let's all on the motion, Commissioner Godu,
Yes.
Commissioner Tombrello,
Yes.
and I vote yes. Next, we're moving into reports, and first we'll start with commissioners' updates. Anybody have anything to share?
I'll be signing up for that Prevagen.
You're just more efficient than you recognize. I think that's the crux of it. Well, we did some cybersecurity, cybersecurity forum today, and it was outstanding. It was so great. It's like, I think just, to get thinking about it and just general awareness, I think is so great for everybody here at the county, and I'm so glad that we are doing these trainings. It's really just such a value and will protect us. We've seen what happened in some of the other counties in Stratford and Hillsborough with these breaches and the devastation it has caused. And I really feel with Robin and Brianna, it's like we're really putting ourselves in a good place.
We're very fortunate.
Yeah, for
You know,
sure.
Brenda that works for us.
And,
Very fortunate.
oh, yes, of course, Brenda too. She's she works so well with Robin and
And we
team.
do what, 15-minute trainings once a month?
Yeah, it's at least every month.
It's every month for us. It's a training that Brenda puts on. It's very helpful.
Yeah, those just quick little snippets of awareness. I think we do them across the county. It's wonderful. It really is. It's great. And, in the way things are siloed and the efforts and that emergency planning, it's all part of the bigger picture, which seems like, when we look at threats to the county, this is probably the most, one of the biggest. So that was excellent. That's my report.
Yes,
You guys have anything else?
it was helpful. No, I'm good.
Union negotiations tomorrow morning. Very, very excited about it. Probably tell by my face. Other than that, Monday I met with the Senate President, Carson, and another senator. We had coffee, talked about some of the county items, and invited them for a tour. They're excited to come see the new building, so we're scheduling there's a few senators that want to go walk through, so you guys, I'll let you know when they come in, and we're gonna go walk through the building. So, very good meeting, and we had some good questions on county issues, so I hope I gave the right answers.
All right.
And I bought, by the way, I met them, and I bought too. Right.
Are you expensing it?
No, it's under $50. They're okay.
All right, we'll move on to facilities operations. We have a change order request with KPMB Enterprises LLC.
I'll make a motion to approve a change order request to KPMB Enterprises LLC for an amount not to exceed $20,248.80 for adjustments and changes required for the 2024 HVAC ARPA project as recommended by the Senior Director of Facilities Planning and IT.
Second.
Discussion?
I could use an explanation on this.
We issued the initial purchase order, and I believe it was 23. It was an ARPA project, so there's no additional funding. Some items have come up, some cost expenses, some items that were no longer available. There were some issues with one of the units in the nursing home that by the time the equipment came, it was summer. And when they took the air conditioning, the condensing unit off the roof, it was wicked hot in there. So we had to authorize additional fans for exhaust and so on. So it's like an adjusting change order to get us to the end of the project.
And
And
it's,
stuff that came up.
I think it's worth to contextualize the change order. This was a $4 million project. So when you think about a $20,000 delta on a $4 million project, actually that's
Not bad.
not bad, as I saw it. Okay,
Thank you.
on the motion, Commissioner Tombrello.
Yes.
Commissioner Godu.
Yes.
And I vote yes. Thank you. Next, we have in the finance office a grant application for the Bureau of Justice Assistance.
I'll make a motion to authorize the Senior Director of Finance to apply for grant funding on behalf of the county and the Bureau of Justice Assistance, BGA, fiscal year 25 Public Safety and Mental Health Initiative Grant for an amount not to exceed $814,065 with a county match of $345,191 as recommended by the Senior Director of Finance.
Second.
Discussion?
This is the one
gonna
we
help,
mentioned before
yeah.
about helping to
Offset.
support the 3 positions in Beaufort Community Corrections. It's a 3-year grant. The county match would really be coming from the personnel fringe benefit costs for those 3 positions.
I mean, this would be a huge savings if we can get the grant and really help in the transition to, getting community corrections up and running. it's almost like, it's like a 40%, it's somewhere close to 40% of the cost for those positions, so it's like significant.
So this amount is over the course of 3 years.
Over the course of 3 years, this is also in addition to the RSAC grant that we're also going for, that's a 1 year. So if we do get the RSAC grant, we will have to file for a revised budget on this grant, because 2 of the positions that we're asking for all 3 years would be covered by the RSAC grant for year 1. But again, that just means more grant funds for the county.
Awesome. Fantastic. So, any further discussion on the motion? Commissioner Godu?
Yes.
Commissioner Tombrello?
Yes.
And I vote yes.
Thank you.
And I think actually it's like, it's more like 70% of the, not, I think I said 40, it's like this grant would cover
It's
70%.
actually weird. Usually it's like a 50-50.
Yeah.
It's like 80, and then.
Yeah.
70.
Yeah, it's 20% match, 20% match in year 3 is a 40.
Yeah. But it's like essentially never tries to, so, yeah. Okay. Moving on to human resources, we have an exception request 7-3 for new appointment rate in long-term care services.
Motion to approve an exception request personnel policy 7-3, no appointment rate for long-term care employee BO as recommended by the Senior Director of Human Resources.
Second.
Discussion? This is based on the individual's years of experience, was 10 years of experience. And so it seems like a good fit with a lot of experience. On the motion, Commissioner Tombrello,
Yes.
Commissioner Godu,
Yes.
and I vote yes. Next, we have a general leave request in long-term care services.
I'm sorry, but there's a date change on that motion.
Okay. Oh, yeah.
What was
The date range, Matt, just if you take this for just 1 second.
They unexpectedly had to go out earlier.
So, that, we have the general leave request. It's B4B.
Motion to approve a general leave request for long-term care services employee JL. Accounting portions of all benefits to continue for the period of April 4, 2026 through April 4, 2026, as recommended by the Senior Director Senior Director of Long-Term Care and the Senior Director of Human Resources.
I think I just make a slight amendment to that motion, which was, it's through July, April 4th, 2026 to July 4th, 2026. As amended.
I second that as amended.
I didn't know I made a mistake.
No, it's just.
That's even better. Don't forget that you're and I'm forgetting that I made motions. We might need to get some.
That was your brothers in. I did tell them
We
to
might
come
need some.
in on the second because we will have seen our budget
Yes,
by then. And then we would know what we were up against when we had conversation with it. But I forgot I did it 2-3 weeks ago.
yeah, exactly. It makes perfect sense. Okay, so turning to the general leave request, is this, adding to the discussion, we have, the motion as amended and seconded. Is this, date certain in terms of return?
It's,
Okay.
pregnancy.
Yes.
Yes. Thank
That's
you.
what I
Thank
seemed
you.
pretty, great. On the motion, Commissioner Godu?
Yes.
Commissioner Tombrello?
Yes.
And I vote yes. We have another general leave request for long-term care services.
I'll make a motion to approve a general leave request for long-term care services employee SH with county portion of all benefits to be continued for the period of March 22nd, 2026 through March 27th, 2026, as recommended by the Senior Director of Long-Term Care and the Senior Director of Human Resources.
Second.
Any discussion? Looks like return to work is scheduled for that Monday, the 30th.
Yes, it's a one day.
Great. On the motion, Commissioner Tombrello,
Yes.
Commissioner Godu?
Yes.
And I vote yes. Next, we have Square 9 Softworks revised statement of work.
So I make a motion to authorize the board to initial each page of the Square 9 Software revised statement of work and authorize the chair to sign all necessary documents as recommended by the Senior Director of Human Resources.
Second.
Discussion? This is just more of a clarification than anything else. So there was there was an initial statement of work, and then there was the contract that signed that omitted some of that, and this is to basically put the statement of work into, they're in agreement with it, but to make sure that we are contractually covered in what the scope of work was intended to be. Correct.
Why do we have to initial every page?
That was like the first one, it requires that they.
Just how it goes.
Sorry.
On the document.
Because Layla said so.
Yes, exactly. Because Layla said.
Because Layla said so. Oh, that.
That was
The
Drew's
boss
line.
has spoken.
That was Drew's line. It was so good. I just had to steal it. Okay, on the motion, Commissioner Godu,
Yes,
Commissioner Tombrello,
Yes.
and I vote yes. Next, we have utilization of county wellness funds for chair massages.
Well, I'll make a motion to approve the wellness chair massages utilizing county wellness dollars for amount not to exceed $2,500 as recommended by the Senior Director of Human Resources.
second.
Discussion? Everybody loves this.
I don't want to take it away. We absorbed all of the Cigna money for the new equipment. And this came up, Eileen has her pulse on everybody and they were asking for it when it was gonna happen. So I felt I should bring it forward.
I think it's great. Like, it really is. The people have spoken, so it's nice to.
Don't spend all the money. What about the ice cream thing coming up?
That's not in the budget.
No ice cream this
I
year?
don't think it was in-
No, we need to talk about that.
The budget starts July 1 and Cigna in their stuff
Oh,
with
okay.
Gallagher is funding it.
I don't know how we, I'll get my ice cream. I don't know how we put ice cream in the wellness budget, but.
It's in their wellness budget, not Cigna's.
Mental wellness,
Yeah.
maybe.
It is. Well, there is research that ice cream is better than other desserts. It is like because of besides the calcium that it actually like absorbs differently. Just telling you. I can find the study for anyone.
I can use that.
I like to see
All we need to know.
Good to me.
On the motion, Commissioner, Godu,
Yes,
Commissioner Tombrello,
Yes.
and I vote yes. Next, we have, utilization of county wellness dollars for quiet room hours.
Motion to approve the purchase of items of the municipal building quiet room, utilizing county wellness dollars for amount not to exceed $68 as recommended by the Senior Director of Human Resources.
second.
Any discussion? Would be good. On the motion, Commissioner Tombrello,
Yes.
Commissioner Godu,
Yes,
and I vote yes. Next, we have long-term care services, MedPass 2627 licensing renewal agreement.
Motion to approve the MedPass 2026-2027 licensing renewal agreement for the period of March 1st, 2026 through April 30th of 2027. Authorize the chair sign all necessary documents as recommended by the Senior Director of Long-Term Care.
second.
Friendly amendment? Just make it May 1st instead of March.
Got my glass. You know, some days I hear good and I don't see, and some days I don't hear good and I see good.
Listen, we're good. We're,
The two of you guys are falling apart. That's all I've heard is
You're
like,
overworking us.
I'm overworking
You guys
you.
have been easy with this budget. It won't be so much
and we're
work.
not gonna have a problem with my budget.
all right, so, do I have a second on the motion as amended?
Second,
Okay,
as amended.
okay, on the motion, Commissioner Godu,
Yes,
Commissioner Tombrello,
Yes.
and I vote yes. Thank you. Next, we have the UNH College of Health and Human Service School of Nursing agreement.
A motion to approve the UNH College of Health and Human Services School of Nursing Agreement for the period beginning March 6, 2026 for a one-year term and automatic renewals of successive one-year terms. And authorize the chair to sign all necessary documents as recommended by the Senior Director of Long-Term Care Services.
second.
Discussion? This is
We
exciting.
host, so we've always done it, is my understanding, so, our nurse practitioner, Donna Rowe, is a training site for the school's nurse practitioners, and it's wonderful to let them see what long-term care has to offer. But essentially, that's what it utilizes, is for, we have a current contract, so. This one was before me, you know, credit.
Right, but you still had Primex, I assume the contract's the same that's been in existence, but we still had Primex would be right with the standard. They have a different type of liability insurance that is sufficient, but different than what we typically look at otherwise. I'm happy we have this contract. It's good. Anything, in the same way that having people come here and seeing all the great work is probably one of our best recruiting tools generally.
Absolutely.
So. Okay, on the motion, Commissioner Tombrello.
Yes.
Commissioner Godu.
Yes.
And I vote yes. Next, we have the Sheriff's Office use of facility request.
Make a motion to approve the request for the use of the Norman Lionel Major Auditorium and waive the facility fee for Tactical Tradecraft Solutions LLC on January 25th and the 26th, 2027 for the hours of 7:30 a.m. to 6 p.m. each day.
Second.
Discussion?
I
Yeah.
think we need a little bit more explanation about who these guys are and why we're,
Yeah,
we
so
want to
the,
host them here.
the reason for the request is this is in particular training that we're seeking out that we want this. So when we essentially want these companies to come in, even though they're charging a registration fee, the benefit of being the host agency is that depending on their registration numbers, we end up getting free slots to attend so that we don't have to pay the registration fees. So and I know that's one of the things that we had kind of talked about traditionally when we had talked about having our own training room in the sheriff's office during the building design, but obviously it was opted to have a much larger venue for everyone to use. So if we start charging these people the per room fee, it's going to essentially just take away from our free training opportunities of being the host agency. Now, with that being said, this isn't a company that's just saying, hey, we're hosting this here and anyone can go. It is for all law enforcement agencies, so it's law enforcement specific training. But it's particular training that we have sourced out that we want to get. And that's why we're asking for the waiver of the administration fee. And with that being said, with us being the host agency, we're obviously going to be here because we're going to be providing probably waters and, light refreshments and stuff like that to accommodate while we're there. And we'll have people that are going to go through, pick up, make sure there's no trash and stuff left on the floors. I don't anticipate deputies grabbing the vacuum, but so I know there will be definitely cleaning sometimes that could be associated with these types of trainings, but part of the goal of being a host agency is to essentially get thousands of dollars worth of free training slots for being willing to host these organizations.
I guess I have just questions about like the cost benefit analysis, right? It's like the hours are extended, so there's extra cost about getting people here. There's extra cost for IT. There's extra cost, the cleanup, the trash, all these things. How many, I ask that if you're okay with it, maybe that we table it and get some more information, because the information would be beneficial for me to see in like weighing the cost benefit analysis is what is the, like sort of the registration information, what's the training, how much does it cost for a individual, what, some of those things, how many individuals from your department do you tend to send, sort of, so that we can look at the numbers and see if it really is, because it might be beneficial from the county as a whole to just say, listen, if they're going to be charging lots of law enforcement, there are plenty of venues. I think this venue is great, but they're profiting, if they're charging. So when we look at, what I don't want to see is us incurring more costs, it's more cost effective to pay for the individuals attending the training to attend rather than, and do it somewhere else then.
I will say traditionally, some of the classes that we've been looking at hosting, especially the week-long courses, they're typically between $500 and $800 per participant for us to sign deputies up. In particular, I know we're hoping that they register enough people that we'll get about 5 slots for this particular training. I believe this one runs about $550 to $600 for this particular course. So if we were able to get even 3 or 4 deputies at a cost savings of $1,500 to $2,000, that's obviously much less than the room cost of the $125 a day for 4 or 5 days.
Well, from my perspective, I would expect that none of our officers would get charged, and we should be able to bring in as many as we want. I don't see the benefit to us deciding, whether they get enough business. We're offering them a room. They're a for-profit organization, essentially, and we're offering them a room that is worth thousands of dollars in comparison to the $125 fee that we put. I would like to see that we're gonna get full benefit from that, from the, I mean, how many officers would you have that would be interested in this training? And I don't even know what kind of training this is really, except
This
law
one,
enforcement.
this one is more specific to interdiction work.
So
Okay.
your guys could actually teach the guys, and I basically could just tell them what I
They
want.
can, but sometimes there are specialized training that some folks that, there are people that do highly specialized training, that is shown to be productive. So there are certain, like, one of the things we plan on reaching out to, we want to be a host agency for, is the FBI LEADA trainings, like the Trilogy Leadership Awards and stuff like that.
But that's like, I mean, I think that, not to interrupt you, are you done?
Yeah.
But I mean, I think that's wholly different. That's a government organization versus a for-profit corporation. And what we talked about when waiving that fee was that we are doing it for nonprofits and government. This is like a for-profit that's gonna charge a lot of people. Why would we, and there's a bunch of costs to be incurred. I think Commissioner Godu, you made this point, why would we, the room fees that sort of somewhat reduce our costs, which are not insignificant. I mean, why would we just like put this back in the hands of the, for-profit corporation who's gonna benefit from charging outside individuals to come here?
And I think the difference is I get it, you don't want to open it up to just any corporation that wants to do it, but these are in particular organizations that we want this particular training, so we're essentially soliciting them to come here.
I agree, but it doesn't mean they, the room fee is, sort of nominal. I mean, the idea is that this is a facility not meant, we're not really, I understand that you guys, it's like a benefit to the sheriff's office. But we're not like, our goal isn't, as a county and our county taxpayer dollars, is not to reduce costs for a for-profit company. And so I think for me, I mean, if you guys are, my inclination would be, we should table this for now. And I'd like to get like some more information about the corporation, about the the training, the registration information, all the details, what's your list of individuals you intend to send to this?
Yeah.
Like all that.
And I will say, so part of the reason this is being set up for next year is because they have to put out their information of when they have a site available, because then it determines how many people sign up for it versus how many free slots we get.
Sure, and I appreciate that, but there's probably enough information, and they probably have done this training previously, so there's probably enough information that we could gather just to have a little more data then. I mean, maybe you guys.
How much do they charge for this conference?
I think this one is usually between $550 and $600.
But we
per
could have
participant.
last year's, I'm sure there's last year's registration cost, right?
We haven't hosted this before.
I know,
We
but
haven't participated in, I mean, yeah.
They have.
Oh, no, I'm sure they have pricing and stuff. I just don't know how much that's gonna change the overall, looking at it as from a soliciting a business versus, I don't know. We're just basing it off the model, and I guess when we envisioned what a lot of our usage would be to use this facility space, we actually based it a lot off of Hampton's training room. Hampton has a very large training room within their PD, and they host a lot of trainings so that they get free classes.
But if they want to come in and use the space and there's a nominal fee and it's just for our, the sheriff's, your department, that's vastly different than what we're talking about here. So for me, I just want more, I feel like we're flying blind at this point, and I appreciate more data so we can just do the math.
Yeah, no, I agree. I'd like to see the number of people we can get in, what's our benefit from offering the room for free? And I'm not against it, I think we need to get that detail, that's all. So motion to table until we get more information.
Right, well, I think we're talking $50 or $75 here, and the major is telling us that we could bring 4 or 5 people in and save the county, because if we charge them, you're gonna come to us and tell us that you want to pay for those guys to go there. So we're looking at $50 or $75
It's a,
We
it's a,
wanna
co-
show off
it's a
our
cost
building.
savings for our
Well, it's a
deputies.
big cost saving, because if we don't, and whatever happens with this vote, and we say, no, you're gonna come to me, Major, or you are Sheriff, to us three, and ask us to support funding it, so it's
Or-
50
or-
or $75.
Who would pay?
I did call Robin today, because I saw this on the agenda. and I
We'd
saw
have,
it
we'd
on
have
my
to budget more
computer.
for that type of training, or we'd have to just not have.
And
the
there's
training.
no overtime for Robin, because I looked at the 6 o'clock thing, and I thought, how can we close the building? Does Robin's group have to close out the electronic part of it? And Robin said, no, she would instruct them how to shut it down, so we can table it, but I'm gonna support it. I want it for $50 or $75, and you're telling me that we're gonna save maybe $4,000. I think it's simple.
It's actually, it is
I'm okay with
$125
that.
Okay,
per day.
all right.
I'm gonna support it.
So I don't want to give anyone the impression that we're renting this room for $100.
No,
This room is worth $5,000.
Oh, absolutely.
I mean, so the fact that we had a fee built in for some of these ancillary services, that's for people who we want to give away the room because it's a benefit and we're just kind of covering costs. So for me, I just like to see how many officers are we gonna
Well,
get?
let's-
What's the value? We're gonna get $5,000 worth of value or, $4,000 worth of value and we're giving them the room for free. Okay, we got $4,000 for the room, kind of essentially.
And it's important, I think, to do that because what we're talking about is jumping into a situation where we have not used our space rented out for-profit.
Yeah, this would be the first
This
time.
is for-profit businesses, and there's a precedent that we're gonna set by allowing this. So if we're going to set a precedent, I sure as heck wanna back it up with like the data that supports what is the value? Because if we give this away without any, say, let's just do it now. Well, now we've set a precedent that we just let for-profit companies come in and use our space and there's there's really no accountability, so.
I can't disagree with you, and what we'll do is, I mean, I'm sure it's great that you guys are gonna table it. Let us do our homework on it, let's see how many deputies are gonna come to it, and we can take it from there. We're just looking at a cost savings on a training line.
No, it's a good
So we're
idea.
not, I mean, it's gonna cost us $4,000 or $5,000, that's money that we can take off that
Right.
training line, because with
No,
today's.
no, it's money we don't have in
We
the
don't
training.
have
line
in
to
our
begin
training
with.
line. But
we
with-
can't lend you.
We
any.
can't do the
But
training.
with the new rules at the academy, they bumped all our hours up to 24 hours a year for training. And you can't use the same training that you've had before, but that doesn't include like our 4 hours of firearms training, nighttime shooting, and a couple other classes that we put on. So we're just looking to try to,
The flip side is that by you saying, oh, I don't have, it's like, this is a great way to have training without any cost to you, but the cost is deferred to other areas of the county, so other people's budgets, whether it's like facilities, whether it's for cleaning of
We got
all
it.
these things, so it's like, at the same time, it doesn't feel right that it's basically shifting the
Let-
cost
let-
burden to other departments.
right, let us do our homework on it, and then we can,
I just had one other issue, and it's not really specifically with this event, but the issue of food. When you have somebody that's coming here for all day, and NHAC is gonna do the same thing, what's the plan for food? Because no one's supposed to bring food into the auditorium. And they probably will anyway, even though we tell them not to. And then there's gonna be cleanup. It's just a consideration of how we're gonna manage food. And this particular one is a long day, 7:30 to 6. Obviously, they're gonna have snacks all day or a lunch break or, where will they go to sit, Suppose we could let them sit here if they want, but this isn't gonna cover the number of, I don't know if it'll cover the number of
I
people.
mean, I think that there's a whole secondary level of, if we wanna move forward, what's the contract with them going to look like? I mean,
Right, well, I'm talking about the
because I
food in
think
general.
I know, but it raises other points about obligation of trash. Who's getting the trash out? Who's cleaning? Who's doing all those things? Whose obligation? Who does that befall? And so I think we need to, those are certain things, if we're bringing in we need to sort of establish some of that baseline. It's like a lot of people here for 10 hours is gonna generate a heck of a lot of trash, so.
Toilet paper.
Toilet paper. That's our budget. That's our budget.
Don't bring it up as a sore subject.
The buck stops here.
They all have to bring in a roll.
Yeah, exactly. No, I mean, it's just like all.
Well, we
yeah.
rationed all our paper towels and toilet paper over the count over our.
So you're now moving it to our budget line. All right, so, so you've made a motion.
I made a motion to table, nobody second.
Okay, on the motion to table, Commissioner Godu?
Yes.
Commissioner
yes.
Cabral, and I vote yes. Okay, so that item's been tabled. Well, then, that's it, move on to department head updates and sweet as all.
I'll try to be brief. Budgets, no surprise. Just a reminder, departmental budgets are due on Monday. Also non-county specials, sounds like there's some more that are starting to come in. Those are also due on Monday. Working on multiple grants, working on various audits. My appointment to the NERS Board of Trustees got officially approved by Governor and Council. So now I have to do orientation period with them as well. Let's see, County State Finance Commission meeting is on Monday. I'm sure the July Medicaid rates will be a point of discussion. And as far as trying to hopefully go after some other funding sources of for care, for long-term care supports. Just a quick reminder too about line item transfers. Basically and there's, from what I can tell, there's lots of lines that are gonna need transfers. So I can go over the departments that, for the lines I have in mind already that I'm looking at, but they'd have to be on the board agenda by April 23rd for inclusion in the 5/8/26 executive committee meeting. And I know we were mentioning about events being hosted in an auditorium. I know Wayne was talking with Tyler about potentially hosting the New Hampshire Users Group meeting later in this year over here. So that would be governmental entities coming here for this New Hampshire Munis Users Group training. So that'd be not even a full day. And that's all I got.
Wow.
That was, I
That was
think, Chuck,
brief.
your
Now I need
fastest.
to shorten mine, I know.
Record, new record set.
He's getting older too, he might have forgot,
Yeah,
right, Jack? Right.
Chuck's like a computer.
Yeah, I know.
Forgetting.
I have nothing to report today. We're buried in budget. It's like all we're doing all the time. So,
Well,
and all
thank
is
you, I guess, thank you to everybody for sort of, I know it's all budget, but it speaks to the diligence and effort everybody's putting into the budget, so thank you for all the effort. Superintendent.
We have a headcount of 193. We just had 3 new officers start on Monday. We have 2 new corporals that are going to be effective April 5th, which is amazing. Second shift's been short for a while, so to have them back up to full complement is going to be a boon. And then we have 3 confirmed to start on April 20th with up to 3 more possible. So there's a chance we could have 6
I
total.
think it's you that they're coming here for?
Naturally. And then, in order, some of the paperwork for that grant we were getting together, we got a letter from Seacoast Mental Health. And so we've been talking with them a little bit, and we had a little issue a while back where we were calling rapid response for some of our inmates that had mental health issues to be released. And miscommunications happened in some of those mobile crisis. People unfortunately had to wait an exorbitant amount of time outside of the facility. So,
Come in.
correct. So they're still willing to work with us. Obviously, they supported us, but they are going to be sending over an MOU, which there's nothing monetary, but just expectations on both sides. So I'll be bringing that forward to the board. And obviously, it's an MOU. Probably have to have legal look at it just to make sure. But that's all I have.
Yeah, so, are you the youngest superintendent? No?
Not in the state, no. That belongs to Nicholas Phillips. So,
I like that you actually know the information.
I was talking to them the other day, I said, we're gonna get a lot of years out of you in your 40s. I tried that up because I'm not in my 40s.
not quite. I mean, don't get me wrong, I do keep track of that stuff. I know I was the youngest lieutenant in the history of the building and then the youngest assistant, but I didn't quite make the youngest superintendent.
It's close enough.
I'll take it.
Go ahead, Pat.
So thanks to Chuck, he came over on Monday and chatted with us. We do need 2 line item transfers, one for expensive prosecution, relative to basically expert witness fees, and our service contracts, which is relative to the PBK contract that we talked about a few meetings ago, but the expense went up, and so we're gonna need to do a couple of line item transfers. Just with regard to the expensive prosecution, we learned that the New Hampshire State Lab, there was a bunch of same kits that needed to be tested. New Hampshire couldn't do it for whatever reason, so they outsourced all the same kits to DNA Labs International, which is in Florida. And they have a contract with them to do it for a couple of years, and there was a grant, I think it was a 1-year grant, where that would pay for the expense of the testing and also the expense of the person coming to New Hampshire to testify. Unfortunately, that ran out. So now the expense is on the counties.
So we now have to, because the contract continues, but now we have to fly the person from Florida up to testify?
Yes,
That's
and
crazy.
it is, and we got a bill for over $11,000
Yeah.
the other day
Well,
for
it's
an
not,
upcoming trial,
it's
which is crazy. So we were
crazy.
able to get them down to 7,000, but, I mean, that's nuts. And I think ultimately they're gonna testify virtually because defense counsel agreed to it. But there are gonna be situations where defense counsel will not agree to virtual, conferencing type of testimony, and the defendant has a right to have the witness there in person. So that's gonna be, unfortunately, it's gonna cause our budget to go up pretty substantially because DNA is super important in most of the time in our sexual assault cases. Also, they're not doing serology testing anymore. So they test for DNA, but when they test whatever it is that is found, whether it's blood or seminal fluid or not to get to, saliva, they don't tell us what the fluid is. They test it for DNA and we'll say, yes, there's DNA or there isn't DNA, but we don't know if it's blood. We don't know if it's seminal fluid, saliva, or whatever. And that can be important in sexual assault cases. So I'm working on a case right now where we're researching. New Hampshire State Lab doesn't do it, so we have to send it somewhere else. And right now we're looking at some lab in Montana, which obviously, right, we just looked at the cost and the testing is really not, it's not too expensive, but they want over $2,000 a day for testimony, even though they only testify for an hour or two. And that's just the testimony, like going to court and testifying. That doesn't include all the travel expenses and putting them up in a hotel.
In the wrong business.
Yeah, I know.
Just saying that.
Just thinking the same thing. I was like, no,
Yeah.
just
Time
us.
plan for everyone here.
Or
So
God.
that's super concerning. And as far as I know, as far as I heard, the lab is still unable to do the rape kits and there's no contract. So I don't know what's happening with that, like who's paying for it, where I don't know.
I mean, talk about another example of the state downshifting costs so substantially. I mean, there should be no cost. The state lab should do it, and then they, drive the hour from Concord to come testify.
Right.
And now it's just downshifted to like this $11,000 to crazy.
Yeah.
Because the
So-
state decided to not
They don't-
have the lab anymore?
The
don't
lab
have
is
to.
there, but they just don't do certain testing anymore. Kevin, I think McMahon used to do it, and he retired, and they just decided that it wasn't something they were gonna continue to do in terms of serology. With the rape kits, I just think at the time, there was an abundance of them that needed to be tested that hadn't been tested, and they just couldn't do it all, so they outsourced it. But as far as I know, they're still doing that, but we have to pay the cost for the expert to testify and come up and things like that.
Well, but if the expert's from out of state, that's a problem. I
It's
mean,
a
we
huge
need
problem.
We need testing close by.
It's a huge problem, but that's, there's not labs necessarily within the area that do that type of testing.
And also,
So-
the state contracted. We're like,
So we're at their mercy,
Mercy.
like they're doing the testing, but then
Right.
we have to pay for the expert to come and testify.
Is there a statutory requirement for them to maintain a lab in the state?
If they do have a lab, they just don't do all
Do
the
that
testing.
They found a loophole.
Well,
Yeah.
maybe we need to work on that legislatively.
yes, That's exactly
Yeah,
right.
and we have a county attorney meeting coming up, so, and I actually emailed, Jim Buffetti about this issue and asked him if there are any grants available, and we learned of a grant from, DNA Lab Internationals, and I talked to Chuck about it, and we've got the grant writer looking into it as well. So that might help offset some of the costs, but I'm just not sure, we haven't looked into it, and it's due like in April, we just learned on it.
Yeah, the state formula grant, which I think states would apply for, is the earlier deadline. As far as the local governments, it's like from the same JAG program, just a different, use of the funds. But we're also gonna confirm, can one entity, two different agencies under one entity apply for funding from the same overall grant program?
So
Would that be a different use of the money?
So we'll look into that, and I emailed and spoke to Jim Buffetti. He was gonna ask the state if there are any type of grants available, but he said he wouldn't count on it. So, at this point, it doesn't look great for us. So I just wanted to let you all know about that. So every year, the CAC does a Champion for Children award for folks in the county. Rusty Chadwick is getting one from our office, so he does a great job for us. I think you guys are getting one, right? The Rockingham County.
Yeah, the
Sheriff's
entire
Office.
agency award.
So that's awesome for Rockingham County.
Yeah.
They have, I think, a ceremony. Is it on April 20?
29th, I believe.
I can't remember, but it's in Portsmouth.
Yeah, I've been to it. It's really
Yeah,
great.
so, that's really good news for us. We've been doing presentations at different schools in Rockingham County on prevention and education about domestic violence and sexual violence. We did one at Timberlane this week. So we're really busy. We have a NECOM manslaughter trial starting tomorrow. It's in Portsmouth. A woman allegedly ran over her significant other and killed him. That's our tomorrow.
The Prescott Park.
Yeah. So we're really busy, but it's going well, except for the DNA thing. That's it.
Thank you.
You asked Chuck for like 10 minutes of his time, is that what happened?
I'm usually really quick, so.
No,
No, you guys are
you
good.
were efficient.
Never.
They're real. Sheriff?
Nothing new to report.
Aaron, do you have anything to share?
Well,
Kathy?
Money is rolling in at Rockingham County Registry of Deeds. We're having a banner month. I spoke to Lindsay Strepp, she's the commissioner of DRA the other day, because she's on the committee with me, and last month was 22% above a year ago. We're gonna be even more this month. It's just been phenomenal, so we're pretty pleased. So it's good,
Yeah,
good thing.
That shows positive economic activity
It
for
sure
the
does.
whole region, right?
Right, so we're pleased. So other than that, everything is same old, same old.
Great.
Thank you.
I mean, to follow that, our census in the nursing home is 142, and our
Wow.
assisted living is at 48.
The nursing home census has just
That's high.
really grown quite a bit. Is that
We
mostly
opened
from
skilled.
Skilled? Yeah.
So when I had started a year and a half ago, we were capped at 8, and then we've slowly increased it, and then we were in a position where with HR's help, we have hired where without increasing agency, we were able to open the whole unit, and we've run it pretty much at capacity with just a bed here or there. And we have also been working really hard. Past practice is if someone went to the hospital, we would hold their long-term care bed as well as have them on skilled, which doesn't always support well for the person, especially if there isn't. So we've been working on building up the clinical capabilities so that they're able to return to their room as well. So it's been great. So we've been supporting the census, and it allows a higher skilled resident, which is a significant increase in revenue compared to a Medicaid resident.
Yeah. I mean,
Drastically, it's a difference, like the average skilled rate is like 600 a day compared to like 2 something a day for Medicaid. Granted, there's costs associated with skilled with it, but it's still.
Skilled is our profit center. If you
Yeah,
will. Now,
it's consolidated, so we have to pay, like, there's a portion of their therapy that gets billed and those kind of components of it, but it's still a higher, the profit, after expenses.
more significantly, like what is so great about it is we've increased our census and in the skilled unit, which means we're able to help more patients within Rockingham County and have, you know, it helps
It's
the,
helped a lot too on the long-term care
Yeah.
side because it's hard to get a long-term care bed. And so when people were in crisis, then they were going home because there wasn't an option. And then it was kind of just increasing hospitalizations and general decline at the same time. Where now that we've opened that, right now we're kind of in a little bit of a bedlock situation because our long-term care unit is completely full, but we have 3 or 4 residents on our skilled unit just waiting for a long-term care bed. Where if they weren't able to come in skills through those beds, they would be at home or they would be going somewhere else and then it would be a transfer and then that doesn't help. So we're able to kind of continue to care for them there and then transition them into a unit. So it has just as an overall, it really has been able to support the whole picture.
And we make money.
and it's better care. And
Yes.
better care for the residents,
Yep.
for, like, because sending them home is like, it's
Especially if there's more falls or more
Right.
declines
it's
or.
like more, it's riskier for the resident, and also it actually generally drives up costs because the response is ER rather than being cared for here in a way that the continuity of care offsets ER costs, which is like the number one driver in insurance
Yes.
increases.
So, and our census has been maintaining. If anything, we tend to not have a bed. So we're right back to the same situation of we have, you know, the other day, I think we had 27 referrals and 3 beds.
Wow.
So kind of trying to, and obviously not every referral is actually looking to come here because they mass send them out, but we're right back to not having enough beds to offer.
Well,
In that stance,
as we
we're gonna get there.
transition to opening up another unit, it's like we're doing so we're getting sort of, I'm using a like corporate term, which I don't really, but pipeline, right? I mean, it's not, and it's not good to talk about pipeline in the context of individuals, because they're people. But from can we support, like, is there the demand to support a new unit, opening up another unit? And do we have the staffing? It's like, it's slowly
Not have the staffing.
yet. No, I know, we don't have it yet,
Yeah.
but the point is that we're building and we're creating the infrastructure. We're getting that, having enough mattresses, getting the units ready. It's like, nothing is gonna happen. It doesn't happen all at once, but I think
Yeah, we've increased our
we're doing.
census on average. A year and a half ago, we averaged about 127 to 130, depending on the seasons change.
Yeah.
And we've been averaging between 142 to 145.
Well, I remember when we were in comparison of who has
I'm not in comparison.
fills more beds. No, but at that time, the comparison was at 130.
same.
Yep.
130, it was about the same at 130. Now,
I remember the day fondly when I was ahead.
however,
You can be if
it
you
also
want.
speaks to, yeah, you're fine with that. That's not happening with bail reform, but it is great to see the increase, like percentage-wise significant.
Yeah, it's truly great. And it's kind of helped as a whole. And we've also been able to identify others who have been able to transition into our assisted living, which again, continues a safer path for them. And they weren't even aware the assisted living was an option or kind of those pieces. So it's really been able to kind of as a whole picture help, which is wonderful. In regards to outbreak, no numbers to report, which is very exciting for me. General, I was gonna touch on the cybersecurity, which you did, but I just wanna say we had like our whole team there for the most part, and they truly did a beautiful job. So have some homework items we're working on, but just a couple small things, but it was really helpful and the team enjoyed it. We worked very closely, Superintendent Banfield and I, on budget recently, which has been helpful, anticipating looking at some of the line items. That's one of the items that we're anticipating, because the way we budgeted versus what our census is we're obviously both on the correction side and then not quite as significantly on our side. It has an increase more than we anticipated. However, I have a call on Monday because one of them, I think it was just shifted wrong. So we'll connect on that. Might just be a reclass, but other than that, we have our new director of nursing starting on Monday, and I'm very excited. Budgeting and busy, and the last thing, in case anyone is even interested in exploring, we had Primex here last week,
Yeah.
last week, for an emotional intelligence training for our leaders. And you get a report. It's a hard pill to swallow the first time you read through it. But you take it's a very quick test, and it helps kind of identify opportunities for growth to not just improve individually, but then it gives you the ability to utilize that for like a leadership and adjust your style to be a better leader. And it was a wonderful training. And you get a very comprehensive test or results from a very short test. And it was right on the money for me, I will be honest, but still feel a little attacked the first time you read it, but it was wonderful. And there's been a lot of great feedback from even my team and kind of taking the, how can I improve on this? And then how that's going to better support our staff and kind of on that side. So very excited about that. Happy to share any information if anyone wants. You can read my report and see if it's something that would help for yours. But it was, yeah.
Allison.
Hi, just mirroring the cybersecurity. I guess we were the first push-off group out there, and it was very well received. It kind of makes you step back and pause and say, we have homework too. What are we going to do? How does that work? And what other departments are impacted by us as well? So we'll be collaborating with finance and payroll, which they don't know yet, but we will be eventually here because our stuff goes to them and vice versa. So, but it was really well done and a lot of questions, and Brianna was very well poised in her facilitating that.
They
And,
worked really hard on it.
yeah.
I'll be very happy to pass on it.
yes, please do.
Thank you.
We are preparing, believe it or not, for open enrollment. There's a lot of the behind the scenes things that have to happen. Of course, we're waiting on some budgetary things that will help us do rates and stuff like that. Gallagher, I have been in communication with them last week and this week. They're on the agenda for next week to present to the board. We do have a meeting with them that Chuck and I will be on tomorrow. Just to go over, slide decks and some comments and just some ideas that they may be proposing to us. And yeah, so I'm looking forward to that call again tomorrow with them to go over that. And we are just busy trying to we have 3 different orientations. We had an orientation last week, we have an orientation on the 30th, and we have an orientation the next week. So we are hiring and we are making good headway on that and doing off-cycle orientations to get people in the door into the departments as needed. So it's really working out well. So that's a good thing. Thank you.
Thank you. Leila.
I have nothing, thank you.
Good. All right. Well, any new business, old business? No? Okay. No, see, is there anyone on board? No public? No public? All right. Time for,
Did you do the Harvey approval?
no, I think we.
That was withdrawn.
It was Joe.
Oh, okay, sorry. I missed that.
Okay. So with that, we will move into non-public session, and I'll take the motion.
Motion to non-public session in New Hampshire, RSA 91-3.
Second.
On the motion, Commissioner Tombrello.
Yes.
Commissioner Godu.
Yes.
And I vote yes. We are now in non-public session.
We need chat for.
Bye. Good afternoon. We are back in public session after discussing 8 non-public sessions, and I'll turn the floor to Commissioner Tombrello to make a motion relative to the non-public session.
We had 8 non-publics today, and I'm gonna make a motion to seal 1, 2, 3, and 4 due to the fact that they could affect adversely the reputation of a person other than a member of this board.
And just a friendly amendment that they're sealed indefinitely because we don't have the reputational issues.
No.
Is there a second as amended?
Second as amended.
Okay, any discussion? On the motion, Commissioner Tombrello?
Yes?
Commissioner Godu?
Yes.
And I vote yes. Do we have another motion relative to an exception request?
Oh, I'm sorry. I was looking for the last
Make a
motion, but go ahead.
That we accept an exception request for a corrections employee RM.
Second.
Any discussion? On
No,
the exception of Commissioner Godu,
yes,
Commissioner Tombrilla,
Yes.
and I vote yes. Now you can whack him.
now.
Not yet.
Not the Italian whack.
Motion to adjourn.
Second.
All those in favor?
Aye.
Aye, we're adjourned. Take care, everybody.
Yeah, they